So Dr. Huntingford's just going to share her screen. While she does that, I'm just going to give a bit of a bio. I think many of you are very familiar with Dr. Huntingford already, but for those of you who don't know her background, Dr. Huntingford is a 1984 grad of the OVC in Guelph. She's certified in chiropractic, acupuncture, rehabilitation, and pain management. She's the owner and medical director of the Essex Animal Hospital, Canine Rehab and Fitness in Essex, Ontario. In 2015, she became a diplomat of the American College of Veterinary Sports Medicine and Rehabilitation. And in 2018, she received her master's in traditional Chinese veterinary medicine. Dr. Huntingford is a consultant for the VIN Rehab Sports Medicine Chronic Pain Board and lectures both nationally and internationally on a variety of topics, including rehabilitation, pain management, and geriatric medicine. She's co-authored several textbook chapters and published a number of peer-reviewed manuscripts. And in her spare time, which based on that sounds like very little, she enjoys spending time on her farm and winery with her chef husband, Harold, and her pugs, cats, and horses, and a few adult children. Sounds like a fun place. So once again, thank you everybody for joining us tonight. I have muted everyone just because the background noise can get out of control really quickly, but please feel free to unmute yourself and ask a question. And without any further ado, I'm going to mute myself and turn things over to Dr. Huntingford for what I'm sure will be a fantastic lecture. So many thanks for joining us.
Well, thanks so much for asking me, Heather. And I'm really excited to talk about this topic because the topic today is about nutraceuticals and herbals to treat pain with, and so beyond fish oil. And I will talk a tiny little bit about fish oil, but mostly we're going to talk about some of the other things that we use. And I want to thank the Antinol people for sponsoring this lecture. Now, I do have a master's in traditional Chinese veterinary medicine, so I do know an awful lot about Chinese herbs, and I know a lot about Western herbs. And if you see our little husky there, you see that he is in the background of one of our current favorite herbs, and we'll talk a little bit about the herb.
The real question is, why do we want to treat pain? Well, if we have a look at some of our canine athletes, we know, number one, why we want to treat pain, and also realizing that they're competing, why we might want to use nutraceuticals to help prevent injuries, and why we might want to use herbals as well to help treat them. Have a look at this flyball dog. Now, I'm sure that everybody can realize, especially when we look at this in slow motion, that this dog is putting a tremendous amount of stress on his front legs. And so I think if we were able to use something to help prevent some of this stress, that would be a great thing. And that's where some of our nutraceuticals come in.
All right, so pain relief is just ahead. I have to apologize. I had recorded something with that last video, so hopefully you could hear what I was talking about. But that was obviously some flyball dogs that we were looking at and wondering why we might want to do pain relief with them. And I think that part is probably very, very obvious. So why would we be interested in using nutraceuticals and supplements and herbs and such things when we have drugs that we can use, and pretty decent drugs for pain? And I am not anti-drug. I use lots of all kinds of drugs. I am a certified pain practitioner, but I do like to use as few drugs as I can. And the reason being because most of the patients that I'm treating either are unable to take drugs because they have a problem with NSAIDs, and that's why a number of them come to see me. Or what will happen sometimes is that they're unable to take it. So, they're geriatrics. They have either pre-existing conditions and therefore can't take many of the drugs that we use, or some of them are already on pain meds and they're just not working. And then we have canine athletes, and I'm not sure how familiar you are with canine athletes, but there are many of them where drugs are not allowed. And for example, sled dogs that are mushing, they are not allowed to take any particular, there's actually a list of drugs that they're not allowed to take when they are competing. And if they are taking them, they are eliminated. There are some that they're allowed to take, but there's some that they're not. It's very interesting. They're not really even allowed to do things like a laser on them or acupuncture during the race. So many of these things are interesting. People like the idea that a lot of the botanicals and the nutraceuticals are natural and they're safe. And so they want the same thing for their pet that they have for themselves. As you see, it says here that 69% of humans with osteoarthritis take supplements. And the most common supplement that they take is glucosamine chondroitin. Whether or not that works, we'll talk about that in a little bit. And, you know, sometimes these things are more cost effective. Now, sometimes they aren't. Some of those Chinese herbs can be quite expensive, but if you have a 120-pound dog, so can meloxicam. And as you know, a lot of times the clients are like, well, maybe I could stop giving the meloxicam and just give this cheaper form. So joint supplements, here we have a man looking at all of these different things. And this came from the New York Times. They ran an article a few years ago about, did joint supplements work for people with osteoarthritis, or, you know, did placebos work just as well? Well, it's very interesting because in the human world, $25 billion a year are spent on supplements, and about a third of that, according to Lou, out of the British Journal of Sports Medicine, is spent on glucosamine chondroitin. Now, we know, if we've been following osteoarthritis in dogs, that about 20% of all dogs, regardless of age, have osteoarthritis. So there's a whole bunch of our patients who could easily take pharmaceuticals or nutraceuticals, depending upon what the client wants. But the interesting thing about joint supplements is, many cases we don't know the pharmacokinetics of these things. So the pharmacokinetics means what does the drug do to the body? So we really want to know what's going to happen with that. What's the right dose? And we don't really know. But that's why they do safety and efficacy studies in a lot of these things. They do them all the time in drugs. Do they do them with natural products? Well, maybe not. We don't know often how these joint supplements interact with pharmaceuticals, and many of them are largely unregulated. Random controlled clinical trials are lacking in a lot of them, especially in our species of interest that we deal with. So I'm going to try to present tonight some that have evidence, and ones that I would use or that I have used, and maybe ones that I would look at twice before I might use them. So Dr. Facchetti from UC Davis has some very interesting guidelines that I think are great for clinicians before they're going to prescribe a nutraceutical. So, I mean, obviously, does the product do what it's supposed to do? Does it have in it what it should? And if so, is it bioavailable? That's always the interesting question. Is it bioavailable? And were the studies conducted in vivo or in vitro? Are they in the species we're dealing with? Did they employ the same dose as is contained in the product? Now, that's a really big thing. If you look at some of these research studies that have been conducted, what will happen is you're like, oh, this product X worked really, really well. And then you take the bottle and you give it to your patient and you're like, this doesn't work at all. Sometimes if you then go back to the study, you find, well, the study used a much higher dose than what's on the bottle here. And so how are these studies well controlled? As scientists, we really should know what makes up a good, well-controlled study. Is it published in a peer-reviewed journal or some kind of reputable source? And what are going to be the active ingredients? You know, some of these supplements have 8, 10, 12, 18 ingredients. And sometimes when they have that many, there are things in them that don't work really well. If you look at Chinese formulas, many times they have a lot of different things. But when you're looking at how Chinese formulas are formulated, that It's kind of a difficult thing to say, but if you look at how they make them, they actually do think about how do these herbals interact. And although you may not know it from looking at a bottle of Chinese herbs, there's going to be one herb that is the king herb, and that's going to be the main herb in the formula that has the main action. And then they have things called the minister herbs, which are herbs that are selected to be helpers to that. And then they have the messenger herbs, and the messenger herbs are the ones that are going to take the active herbs to the place of action. So that's how Chinese formulas are made up. But many of these other herbal formulas are not made like that. We also need to think about what other medications is my patient receiving and how might the nutraceutical interact with them. Here's an example for you. I don't know if you're familiar with the herb hawthorn, but hawthorn has effect on the cardiovascular system, particularly on the contractility of the heart. If you have a patient who's on Vetmedin, having a supplement that has hawthorn in it may not be a good idea. Now, I have used the two together under very specific circumstances, but these are things that you need to ask yourself when you look at, say, maybe an unknown nutraceutical. Your client brings you in something, I want to know if I can give this St. John's wort to my dog that's already on Zantac. So, you really want to have an idea of what's going on with that. So what kind of work has been done with these nutraceuticals for safety? What kind of safety and efficacy studies do they have? And is there a margin of safety between the effective dose and the maximum safe dose? So how do you know if you have a good herbal? So you're going to ask those questions that Dr. Fassetti had listed out to yourself, and you're going to look at your herbs and you're going to say, well, really, if I get something at Costco, at Walmart, they're going to have something good. I'm sure that I could get it there. Well, so in the United States, the Journal of the American Medical Association, they had a study that showed that there were unapproved pharmaceutical ingredients in nearly 800 supplements. So that's kind of upsetting. And then in 2015, there were these 4 major retailers who were cited for dangerous or fraudulent herbal supplements. 4 out of 5 of the products contain none of the listed ingredients on the label. So in the US, the FDA does not regulate supplements. Here in Canada, we have the Natural Products Act that has natural health products, and there's dietary supplements that are regulated by this particular regulation, and they're treated as non-prescription drugs. But the thing is, not all of the nutraceuticals on the Canadian market have a natural health product number. Not all of them probably needed, but some of them certainly do. But products are approved and licensed, and they require a list of ingredient types and doses if you're here in Canada and you're looking at some of the natural health products. So our regulation system is probably better than that in the States as far as that goes. But what if your client brings you something that is not a veterinary supplement? You don't see a natural product number on it. You want to know about it. How do we know that it's any good? Well, if it's a responsible company that's been around for a while, that's a good thing to know about. Quality assurance, maybe by an outside lab. And when I'm talking to people, particularly about CBD, I really want to know that I have outside lab testing as to what's in the stuff. For our animals, the National Animal Supplement Council has a seal that's quality seal. There's a bunch of different regulations they need to go through to ensure good manufacturing products, that GMP, that's a human thing. And what you want to see when they do these studies on this thing is that they've done in vivo testing. Now, there are thousands of animal supplements, and there's less than 100 of these companies that are NASC members. So you need to think about that. So this is a human meta-analysis. I've cited this before, Liu et al. From the British Journal of Sports Medicine. And he looked at all these things because this is a meta-analysis. They look at a bunch of different things that were done, trials and papers that were produced and studies, and then they look at them and they figure out which ones actually are good, and then they let you know about it. And many of these things are open access and you can read about them. But anyway, they ended up with 69 random control studies that had over 11,000 patients, and they were looking at 20 supplements for hand, hip, and knee arthritis. And most supplements used, they found, were not clinically effective, including glucosamine and chondroitin. And here's something of interest, put this in the back of your brain. The only supplements that were effective for pain in medium and long-term studies were green lip mussel extract and undenatured collagen type 2. And some of you may not know what either of those are. Maybe you do, but I'm a huge fan of undenatured collagen type 2. And I think it is really a player in the market, a very, very small player in the market. But when I look at the evidence, I'm very impressed with that. And I'm very impressed with green lip mussel extract. So boswellia and curcumin do show a moderate effect on pain and disability in the short term. And this was in people. So what are the common supplements that we look at for veterinary pain? Well, we're going to talk a little bit about pentazocine, which is our cartrophin, and we're going to talk about adequine, glucosamine, green lip mussel, some undenatured collagen, and the botanicals, really. We're going to talk about those. We're also going to talk about, when we talk about polyglycals, aminoglycans, we'll talk about hyaluronic acid as well. So pentazocine polysulfate, I'm sure most of you here in Canada have used this before for our joint dogs. And what does it do? It's going to stimulate hyaluronic acid and GAG synthesis in the joints, right? And it also has the interesting thing about inhibiting proteolytic enzymes such as the MMPs. And I've used it for ages, and I've used it in dogs post-surgery, pre-surgery. And I know that there has been some thought, does it actually decrease platelet function, and is there going to be a problem with bleeding with these dogs, and should we not give it pre-surgery? Should we wait a while post-surgery? Well, maybe we should. There is actually now a caution, not on the Canadian label yet, I don't think, but it's certainly in the product monograph. So I guess we should maybe be a little thoughtful about platelets and maybe waiting till after surgeries are done before we use this. And here is its friend, adequine, which is found mostly in the US. We used to have it years ago here in Canada, was then taken away. Apparently it's coming back. And basically these things really do sort of the same thing. They're going to stimulate collagen synthesis and breakdown. The thing about this is that both cartrophin and adequine do have research behind them that they work. And I'm sure all of us who've been practicing for a while have used either one or both of these things, and we found them to be very, very effective. Now, mostly here in Ontario, we're using cartrophin because our adequine isn't available yet. And I mean, I'm using it once a week for 4 weeks, and then I'm using it once a month. Now, you can use it once a week for 8 weeks, and you could probably even do it like they do adequine here, twice a week for 4 weeks, and then once a month. You can kind of play around with it. And if I have patients who are on cartrophin, what I will do sometimes is if their arthritis is becoming worse and I think they need more chondroprotection, I will go down from the once a month to maybe every 2 weeks or every 3 weeks. Sometimes that helps them. Now, how about hyaluronic acid? Well, we know that what it is it's a non-sulfated GAG. We know it's produced in the joint, and it's going to be responsible for lubrication and viscoelasticity of the synovial fluid. We know that concentration and molecular weight of the HA that's in our joints starts to decline with age. And as osteoarthritis progresses, our hyaluronic acid declines as well, has anti-arthritic effects. It's being used now for ophthalmic uses, dermal burns, wound care, other health conditions, and it's a big thing for skin care. Any of the ladies know that you can get anti-wrinkle cream, at least if you're, over 25, you might want something. And the hyaluronic acid topicals are very, very popular for that. So it would appear that the molecular weight of hyaluronic acid plays a critical role in the formulation of products for osteoarthritis. And there's a very interesting open access journal, the Frontiers of Veterinary Science, and GUPCA has a whole review article about hyaluronic acid. So if you're really interested in it, you can read about it. So how are we using this? Well, mostly I'm using it injectably and I'm using it intra-articular, and it does work. But there's supposed to be a new high molecular weight formula that's supposed to be orally bioavailable, and they have that now in Movaflex. But anyway, there's one paper by Ballou from the Journal of Chemistry, Food and Agriculture and Food Chemistry, and shows that the oral hyaluronic acid works, but there's other papers that sort of show it doesn't. So there's really a controversy there. And we're not really sure if it's actually working orally or not. There is some pharmacokinetic data that shows that when it is administered orally, the high molecular weight one, that it's reached the joint. They did a targeted study, looked where it went, and it did get to the joint. So it does provide some rationale. I'm not 100% convinced. I think for now, I'm probably just going to give my hyaluronic acid mostly by intra-articular injections. How about glucosamine and chondroitin? Well, there are positive and negative studies in humans and dogs, and possibly as many as 30% of dogs might not absorb it properly, and that's probably true with people. And is it due to the fecal microbiome? I have heard about that talked about, whether that's true, because, you know, my fecal microbiome is going to be different from those who are in Vancouver. And so it's possible that that might affect whether my glucosamine is going to work or not. So there've been positive and negatives for this particular supplement. McCarthy had a great paper where he was showing that it was quite effective. However, it was a positive control only with carprofen, sorry, no negative control. And it was subjective assessment. And they said that, yeah, they felt that by day 70, it was helpful. So there's a few problems perhaps with that study. And then Morrow had one where he said, okay, I'm going to compare two nonsteroidal anti-inflammatories, carprofen and meloxicam, with glucosamine and chondroitin. What he found was that both of the NSAIDs worked and that the glucosamine and chondroitin didn't work. So glucosamine, chondroitin, we probably have it on our shelves. We sell it to our clients, but you know what? Maybe we shouldn't, or at least not a straight form. Don't tell them to go to Costco or Walmart and get their glucosamine, chondroitin, because number one, it might not have in it what it says. And number two, it may not work. So how do you know if that one has in it what it says? You can belong to something called consumerlab.com, and they do a lot of independent testing, and you can look up the supplement. If a client brings you a supplement from Walgreens or something that you're not familiar with, you can always look it up in there. It does cost to belong to that particular consumerlab.com, but I have enough people ask me about Neutraceuticals that I have a membership. So let's talk about the eicosanoids. So when I'm talking about eicosanoids, I'm talking mostly about either krill oil, fish oil, green-lipped mussel, possibly marine algae. So why do those sorts of things work? And I know this is a beyond fish oil because we're not going to get into all of the fish oil stuff, but how this works, let's see if I can get my pen to work here. There we go. So if we have a normal inflammation cascade, here we have arachidonic acid in our membrane. The membrane breaks down and then we end up getting these nasty things here. And what do we have? We have more tumor necrosis factor alpha, MMPs, lots of inflammation and pain. If we take in EPA, which is going to be found in green